I'm going to do the presentation for the class of Analysis of Beauty. My name is Shin. There are 3 contents to review today. First one is a dual approach to understanding facial perception before and after blepharoplasty. The second one is evaluation of personality perception in men before and after facial cosmetic surgery. Third one is role of facial attractiveness in patients with slight to borderline treatment need according to aesthetic component of the index of orthodontic treatment need as judged by eye tracking. The first one is a dual approach to understanding facial perception before and after blepharoplasty. This journal is published online 2017 August 31st. The key point of this journal is to question, does blepharoplasty improve rating of age, attractiveness, health, and energy level in female patient? The finding of this journal consists of it's a web-based survey study of 401 participants evaluating photograph of 10 patients, pre-operation and post-operation. It's rated as appearing significantly younger and more attractive than pre-operation. They look healthier and less fatigue after blepharoplasty. Improvement in perceived energy level after blepharoplasty. The meaning of it is that after blepharoplasty, significantly improved casual observer rating of age, attractiveness, health, and energy level in women. Patients perceive significantly improvement in energy level after. So the blepharoplasty consistently rank among the most common facial plastic surgery procedures sought by both men and women. However, there is little research focused on quantifying how the eyelid surgery changes facial perception. So this journal's objective is to quantify the effect of the blepharoplasty on facial perception and measure the patient report rating of the fatigue before and after surgery to compare observer and patient perception. This was a web-based survey experiment conducted from January to February 2017, featuring photographs of the female patient before and after. And observers were randomly shown to independently image of each patient and asked to rate the perceived age, attractiveness, health, and energy level. So the main outcome and measure was that a multivariate mixed effect regression model was used to quantify the changes of each domain after the surgery. The ordinal rank change was calculated to provide the measure of clinical effect size across the domains. To analyze the patient report outcome, Kruskal-Wallis test followed by Mann-Whitney's test was performed to determine whether there was difference in patient perceived tiredness based on operative status. The result was that total 401 participants successfully completed survey and evaluated before and after photograph of 10 female patients, mean age of 59.8 years. The rating was perceived as the health and energy level also improved significantly, and also that the patient significantly improved rate of energy level compared to those who had not undergone blepharoplasty. And also that multivariate mixed effect model was revealed individually perceived as appearing significantly younger by 1.04 years, CI value of 95%. The conclusion is that this was to quantify the perception of facial aesthetic changes followed by blepharoplasty, and this data demonstrate that individuals are rated as appearing more youthful, attractive, and healthy after the blepharoplasty. Blepharoplasty is a surgery that performed more than 200,000 procedures performed in 2015. And it's a procedure to rejuvenate the aging of face. And eye plays a crucial role in social functioning, social contact indicating the interest and engagement. And also it relates to age-related changes alter the appearance of the eye, which it consists of excess eyelid skin, fat herniation, and the wrinkles around the eyes. Blepharoplasty yields mean age of reduction of about 2 years. And fatigue in changes of appearance of eye. Specific cues of fatigue cited is hanging eyelid, dark circles, wrinkles, and fine line. And these primary concern of patient was appeared tired. So furthermore, understanding of the how blepharoplasty changes rating of the energy level will improve the importance as a 2016 survey by American Academy of Facial Plastic and a reconstructive survey uncovered by a new trend. And these patients are seeking the procedure with the hopes of appearing less tired. The primary objective of this study is to measure the effect of blepharoplasty on several facial perception domains. It's aimed to quantify the effect of the surgery on the traditional domain of the age of attractiveness, explored how surgery can affect the rating and perceived health and fatigue. So by examining the rating of fatigue, both patient, the observer's perspective, physicians will be better able to counsel the patient regarding this important domain. So this was a prospect randomized web-based experiment, participant of 401 participants, and the instrument was Qualtrics survey software, looking at the photograph of the faces, and photograph of 21 female patients, and the 10 individuals selected for inclusion for final survey. So this method is prospect randomized web-based experiment. This review was actually approval was obtained study from the Johns Hopkins University School of Medicine Institutional Review Board. And this Qualtrics participants were instructed that they would be looking at the photograph of the faces, some of the which has undergone the blepharoplasty and some had not. And this photograph of 21 female patients who underwent upper and lower blepharoplasty for either cosmetic functional reason. We have used the Delphi method. 5 expert grader provided rating of the patient candidacy and the surgical outcome, and these were used to narrow the image pool to reflect optical surgical outcome. So of the 10 individuals selected for inclusion of the final survey, 7 had undergone the upper blepharoplasty, 3 had combined the upper and lower blepharoplasty. For all patients, bilateral upper blepharoplasty was performed, and the one patient was noted to have the ptotic lacrimal gland that was repositioned during the surgery. Lower blepharoplasties were performed using the transconjunctional approach, with one patient undergoing the concurrent laser resurfacing peel. For each of the photograph, observers were asked to estimate the age of the face using the slider bar ranging 30 to 80 years that could be moved up or down 1 year increment. Participants were asked to rate perceived attractiveness, health, and energy level of the individual in the image using 100-point visual analog scale with 1-point increment for attractiveness. And for health and energy level, this statistical analysis was performed by STATA, version 13 SE, STATA Corp, aimed to quantify the clinical effect size of it, changes in each of the domain using the ordinal rank change approach. For the patient perspective pilot study, total of 161 patients who presented to facial plastic surgery clinic with an eye-related concern from January to February 2017, and they were eligible to complete the survey, including VOE questionnaire. The instrument is that, do you feel like appearance of your eye make you look tired? Patient offered 5-point Likert scale ranging from not at all to completely. Statistical analysis responses to the BOE represent ordinal data. A Kruskal-Wallis test was used to determine if the statistically significant differences existed between 3 patient groups. Bonferroni correction was applied to account for multiple comparison. Our data show that if the 100 people were randomly sampled and ranked from the least attractive to most attractive, the individual ranked 50th average would be expected to shift to position 62 in attractiveness following the surgery, with this higher value representing more positive ranking. For the domain of the health, the individual ranked 50th would be expected to shift to position 60s, and for the domain of energy level, individual ranked 50th would be expected to shift to position 68. The ordinal rank changes in domain attractiveness, health, energy level, and displayed pictorially in figure 2. The difference in patient reported tiredness score based on operative status. The data from 161 patients who completed the BOE questionnaire are depicted pictorially in this figure. The initial Kruskal-Wallis test indicated that there were statistically significant differences between the patient group. Planned post-hypothesis comparison using Mann-Whitney's test showed that there was no significant differences in energy level rating between the new patient and returned patient who did not undergo blepharoplasty. However, statistically differences in ratings between new patient and postoperative blepharoplasty patient and return patient who did not undergo blepharoplasty and who did go under blepharoplasty. So discussion. After blepharoplasty, female patients are perceived more youthful, attractive, healthy, and energetic by casual observer. So the evidence shows that attractiveness rating decreases as the function of age. Our data suggests that blepharoplasty leads to decrease in perceived age, which may then contribute positively to rating of attractiveness. Our data also demonstrate that after blepharoplasty, patients are more perceived significantly more attractive than their preoperative counterpart. These findings may have broad implication of these patients, as attractiveness has been shown to confer both social and professional benefits. We suspected that this finding may be explained by the fact that isolated blepharoplasty changes only appearance to the eye, and it does not change the other features that are used to estimate the age. Also, perhaps signaling the increased importance of the eye when we are judging how tired a face appears. And Knoll aimed to understand the feature of the eye associated with tiredness. Their findings suggest that tiredness rating were associated with ptosis of the upper eyelid. The conclusion is that this study demonstrated that individuals look more young, attractive, healthy after the surgery. The second journal to review is Evaluation of Personality Perception in Men Before and After Facial Cosmetic Surgery. Facial cosmetic surgery improves in the perceived physical attractiveness and youthfulness. The object of this study is to examine association between facial cosmetic surgery in men. The design is cohort study. Result is a 145 participant completed survey, photograph of 24 men who underwent surgery. Score increases were significant: attractiveness, likability, social skills, and trustworthiness. Introduction. Facial profiling appears to be evolutionary adaptation in response to facial quality that are subconsciously associated with specific personality attribute. Traits that have been shown to be reproducibly judged in neutral facial evaluation include likability, social skills, extroversion, trustworthiness, aggressiveness, and risk-seeking behavior. And this attractiveness is strongly associated with sociability, dominance, happiness, and success. The purpose of this current study is to evaluate and quantify the changes in personality perception of men who had undergone facial cosmetic surgery. Approval of this study was obtained from Georgetown University Medical Center Institutional Review Board between January 1, 2009 and January 31, 2016 were then reviewed. 24 patients with adequate appropriate preoperative and postoperative photo. There were 48 total sets of photo, total of 6 survey, including 8 sets of photo, were constructed. Each of this survey was sent to 36 lay people via web-based survey tool called SurveyMonkey. 7-point Likert scale rated level to which they believed to criticize the appearance of others. This survey response rate was 54.5%, which is consistent with published benchmark and average trends. The majority of respondents was white men between the age of 25 and 34 years and had a bachelor degree higher level of education. The patient in Figure 1 demonstrate improvement of attractiveness and social skill, and he had also statistically significant different perception in extroversion, risk-seeking, and masculinity. Lastly, patient undergoing rhinoplasty experienced an improvement in attractiveness with increased likability, and this figure demonstrates the result of patient following rhinoplasty and chin augmentation. When the analysis was performed on the procedure-specific basis, chin augmentation was only procedure not associated with the changes in perceived attractiveness, masculinity, or personality. In contrast, upper blepharoplasty, lower blepharoplasty, brow lift, facial lift, neck lift, and rhinoplasty did show statistically significant changes in ratings. For each of the specific facial cosmetic procedure were evaluated statistically, significant changes were seen at least one measure domain of the personality, attractiveness, and masculinity. The current study revealed increased perceived masculinity after neck lift procedure. A well-defined jawline is a traditional masculine trait, and it is seen as a sign of physical fitness and athleticism. It is unexpected that the similar enhancement of the perceived masculinity was not seen in patients undergoing chin augmentation, and it may be due to small number of participants. Changes in personality and perception appear to be related to specific anatomical area of face. Corner of the mouth, fullness of cheek, happy expression of plays important role in perception of personality trait. Oral commissure indicates more likable and trustworthy. Eyes shows trustworthiness and vitality. Wider palpebral aperture looks less tired and more engaged. Rhinoplasty has no significant changes in personality perception or masculinity, but increase in facial attractiveness. The conclusion is that how the surgery influenced the facial cosmetic surgery on the personality perception in women. In the previous study, taken together, findings suggest that both men and women undergoing facial cosmetic surgery may experience the changes in perception of their attractiveness, genderless, and personality. The third journal to review is the role of facial attractiveness in patients with slight to borderline treatment need according to the aesthetic component of the index of orthodontic treatment need as judged by eye tracking. This eye tracking research is a layperson's view ranging dental attractiveness level differently depending on the facial attractiveness level. The objective of this study is to determine the level of viewers' visual attention in its treatment need category level 3 to 7 for a person considered attractive, average, or unattractive. The method contains 5 composite images viewed twice by 66 lay participants using eye tracking aesthetic component of the index of orthodontic treatment need level. The result is the 6 areas, level 3 to 7, viewed of all facial attractiveness levels showed an increase in attention to mouth. Conclusion is that dental attractiveness amplified in facially attractive female models compared to with an average unattractive female model between near ideal and borderline severe dentally unattractive level. Introduction. Smile plays a role in overall facial attractiveness. Affects other personal attribute and the quality of the social interaction, and also systemic review outline what morphologically define attractive smile. Background facial attractiveness of model affect how smiles were perceived and the converse, which means the evidence of interaction, and the subject self-reported the area of viewing interest did not necessarily coincide with those they actually reviewed. Hickman says that near ideal smile did not receive much visual attention when placed in the face that were considered to be well balanced with harmonious jaw relationship and feature. Richard, for female model, unattractive smile received more visual attention compared to other facial area in average. So let's go back to what eye tracking is. Eye tracking records a person's gaze, location, and duration. Eye tracking is a viewer's eye movement are tracked and recorded while they view images, and it's reliable in showing which features the viewers view most frequently, which indicates fixation density, and how much time they spend viewing those features, which indicates fixation duration. To define the level of attractiveness, this journal has used the aesthetic component of the Index of Orthodontic Treatment Need, IOTN, to help to prioritize the need of orthodontic treatment, and it is to quantify the functional and aesthetic needs of the participant. 10 levels of dental attractiveness from 1 to 10 using color, intramural frontal photograph, indicating level 1, most aesthetic, level 10, least aesthetic. The levels are grouped into 3 treatment need categories. 1, no slight treatment need, level 1 to 4. 2, moderate borderline treatment need, level 5 to 7. 3, definite treatment need, level 8 to 10. Level 1 and 2 have no or little treatment need. Level 3 has a moderate treatment need, and level 4 and 5 have definite treatment need. Depending on the facial attractiveness, viewers' attention to model's smile, their expectation among viewer consonance between the facial attractiveness and dental attractiveness. When not in harmony, unattractiveness smile is more noticeable. IOTN dental attractiveness category level 3 to 7. It is unknown whether there is gradient increase in visual attention to dentition as it becomes more unattractive, or whether there is a critical point in the level of smile aesthetic that draws significantly more visual attention. Furthermore, it is unknown how visual attention in this borderline region of the dental attractiveness is affected by the facial attractiveness. This aim of study is to determine the level of viewers' attention in the ACIOTN treatment need category of 3 to 7 faces that are considered attractive, average, and unattractive when evaluated using eye tracking technology. The material and method. The level group into 3 treatment need categories. Image collection from the previous study. Facial images of women of 18 to 30 years old. And this was very interesting that the only images of white models were used to eliminate the ethnicity as a variable. After collection, 199 smiling facial images showing no teeth were rated by 36 young adults with no professional and dental expertise. The photograph was rated attractive, average, or unattractive 3 to 1, respectively, without further definition. Image of 41 model. The first group had a mean facial attractiveness less than 1.5, denoting unattractive. Second group, rating of close to 2, average attractiveness. Third group, rating of 2.5 or greater, meaning attractiveness. The frontal intraoral image of dentition varying level of dental attractiveness was obtained by searching the record of the University of Ohio Clinical Archive. Each image was rated assigned at IOTN level. The image was rated by experienced orthodontist to confirm the level of dental attractiveness. The goal was to obtain the multiple similar images level 3 to 7 dental attractiveness defined by ACIOTN. The images of 3 levels of facial attractiveness were paired with 5 levels of dental attractiveness. This was accomplished by using the image processing software. This process resulted 15 possible combination of dental and facial attractiveness, resulting images of pairing, smiley face, intraoral images displayed only by the dentition, each of the smile allowed. Once again, eye tracking program is used. Interest area captured the viewer's fixation location where the viewer's gaze upon 80 milliseconds or longer. So 79 participant was recruited, and inclusion criteria was 18 to 30 years of age, as I mentioned. And also the viewer ethnicity was limited due to bias of the differences of ethnicity. 15 images were shown in random order. Each image was displayed for 3 seconds. 15 images were then repeated in new random order of reliability. And using the eye tracking software, measured the fixation duration and fixation density. After eye tracking section, the short questionnaire was performed. The result is that 66 was included in analysis, 42 were female, 24 was male, and a mean age of 22.9 years. For fixation density and duration, intraviewers reliability ranged from 0.71 to 0.96 among the 6 interest area. Interviewers' reliability ranged from 0.56 to 0.93. The area of first fixation was not examined because of the previous study has shown that location of the first fixation for smile image is not reliable. For both of the fixation density and fixation duration repeated measure, ANOVA showed significant four-way interaction between the facial attractiveness, dental attractiveness, interest area, and viewer sex. Differences between the dental attractiveness level were examined within the context of the four-way interaction. Unattractive models, there was no significant differences for the density and duration data between AC-IoT and level 3 to 7. Attractive women show significant differences for density and duration for the mouth, both between the AC-IoT and level 3 and 7. Regarding both male and female viewer, looking at the average and unattractive female faces, fixation duration and density area data show that uneven but gradually increasing attention to the mouth as the dentition become more unattractive. Discussion. Between AC-IoT and level 3 to 7, viewers of the all facial attractive level shows an increase in attention to the mouth. It seems that evidence that some circumstances facial attractiveness affect the evaluation of the dental effectiveness. The implication of the importance of the dental attractiveness in facially attractive person was also demonstrated in the study of Richards et al. What have been criticism of AC-IoT in the past is that too much subjectivity in assessment and the differences of perception of need between the professionals and lay people can be addressed to some extent by our finding. Female viewers devoted more attention to the eye than the male viewer, who were more likely to focus on mouth and conclusion. Findings suggest that subjective decision on where dental attractiveness become particularly noticeable are coincident with what object measures show. This can be used as reference when prioritizing patient treatment need. Thank you.